HPV is an exposure. The moment this virus is all over in the environment, but most important, the exposure for men and women is a sexual exposure. So we advise and encourage women and men to minimize the number of sexual partners to one. The many more sexual partners you have, the more you get exposed to the HPV infection. So it would be nice that you remain with your one partner and do zero grazing. That is the best advice we can give to men. 2, continually visit these facilities for checkup, at least every 1 year or every 2 years. Go to the facilities and be checked. That will also help you. Yeah.
That you had your body, or now there's some change that take place in that part of the body screen. Let's say cervix. There's some abnormality has started, but not yet a full established cancer disease. But it is a pre-form of it. Our health workers here, our nurses, our doctors here can treat and clear it. We have the device for them for free of charge. But when you wait for it to get established, for example, eat the entire cervix, go to the uterus. That other alternative treatment which are available in our centers here will now not help you. You must now go to Uganda Cancer Institute. You must go to Mbarara Cancer Institute to get complex treatment, including maybe removal of the uterus, doing surgery, hysterectomy, including maybe doing radiotherapy, taking chemotherapy, those complex drugs, which can be very, very expensive at that stage. You may get it for free by luck, but what you're getting there has not been gotten free. The drug there, somebody paid for it. Either government Uganda has paid for it, or some development partner has contributed that money to pay for it. But when you're asked to pay for it, the standard market price, like in Europe, America, average complete cancer treatment is average of 300 million with one person. Who will have that money based on our income status? And
opportunities that can increase cervical cancer screening. One of them include screening women who come for family planning services. Because everybody who wants, most of the people who want to use family planning services means that they are either mothers or they are planning to prevent getting pregnant. Secondly, the mothers who bring their children for vaccination. It's an opportunity when you bring your child for vaccination also to be screened. And all the others. We encourage integration of services. When these people are getting screened for cancer of the cervix, cancer of the breast, the men should also go in for prostate examination. And these same people can also have their blood pressure checked, they can have their blood glucose checked, because all these conditions, they go together, they are all non-communicable. And our health workers can provide them. I thank you very much.
Of recent, we had in collaboration with the Ministry of Health and Cancer Institute in Murago, with the assistance and funding from the Korean government, we got issues to do and to address the issues related to cancer of the cervix. Cancer of the cervix being the biggest burden in all the cancers affecting the women, and the Korean government thought that it could support us and we could also attack the prevention of cancer of the cervix. So in this regard, in Mbarara City, we have had very many engagements with the Uganda Cancer Institute, and we had the issues of training health workers in the identification of cases. First of all, after the introduction of the subject, we had to go through the training of health workers through screening of all women for cancer of the cervix. So the trainings were done in Mulago, and then practical sessions were held in various facilities. And here in Mbarara, all our facilities from level 3 up to regional referral, they were all trained, and they have the capacity and ability to screen for cancer of the cervix. Then after that training, now activities came down to the facilities. We have had several engagements, several screening campaigns, and we are still having one. Now for this time, we are now doing screening at community levels. So we are doing community mobilization through vans, through radios, through TVs, and even that's why we are here. So we are trying to tell people, because we are visiting communities in the villages. Yesterday, we were in Katete, and we screened about around 60 people for cancer of the cervix, and about 6 tested positive, and they are on good treatment, and they were sent home. And I hope that they will not develop any more cancer of the cervix. But this one is a good thing, because when you identify it early, you get treated, and then you are free of cancer of the cervix. So today we shall be in Biafra, and even subsequent days in other areas. So we are still continuing, and we shall keep going to all villages under support from the Korean government through Uganda Cancer Institute. So that's basically what I wanted to tell you. But another thing I wanted us to understand is cancer of the cervix is a very, very bad disease. It is very big. It's a burden. Almost 10%, all 10 people of all women have cancer of the cervix. But because they have not tested, they cannot know. They have not screened, they cannot know the signs. Because it comes, when signs start coming, it means that your cancer is already advanced. But before the signs, we can screen and know that this one has the signs of cancer, and you get treated. So that's why we want to reduce the burden and also the complications, because once you get the cancer of the cervix, it's a very bad disease, and it is really affects someone's life very, very badly.